Hello and welcome and assalamu alaikum. My name is Danish Bhatti. I'm a movement disorders neurologist. I am currently working as Director of International Neurology Program and Director of Parkinson's Disease Program at University of Nebraska Medical Center. My passion is teaching movement disorders and neurology. I'm currently the Associate Program Director for Movement Disorders Fellowship at University of Nebraska Medical Center, and I also run an online mini fellowship in movement disorders. So the purpose of this course is to familiarize you with movement disorders and do teaching and learning in a fun way. So I know most of the complex subjects like movement disorders require a lot of reading, a lot of review of articles, and even some research. But that makes it very cumbersome and makes it difficult to access by a general physician, a regular physician, a primary care provider, or sometimes even a general neurologist feels overwhelmed by movement disorder cases. So my thought was that why not I do teaching through clinical cases where we rather than going a structured way, okay, chapter 1, Parkinson's disease, chapter 2, tremor, chapter 3, chorea, so on and so forth. We just do these random clinical cases and learn not only some details on these specific conditions, but also learn the basic skill of how to approach a patient with abnormal movements. So I hope you enjoy this course. I wanted to give you a quick walkthrough on what you should experience at this course and what you should expect out of this course, and a couple of points and assignments. Basically, this course requires, to successfully complete this course requires what I call proof of work. Proof of work means that you just have to show that you have put some work into doing this. And there is no high stakes. There is no exit exam that you have to pass. There is no curriculum to review or textbook to revise. You just have to show some work a little bit throughout the course here and there for us to say, okay, you have put the work in and you probably have gotten something useful out of it and hopefully will help your patients, which is the primary reason behind this course. So let's quickly look at some of these details and assignments. So let me share my screen here. So this is the course on movement disorders through clinical cases. You will see, and welcome to the course section. It is a walkthrough on how to use this player or learning management system. But I think the most important tip to remember is this black discussion button. By default, the discussions are hidden, but if you click on it, it will show up on the right here and you can create a post and type your question. Right? And there's the question and you can reply to it and so on and so forth. And by default, this is hidden and you just have to click this black button and it will show you a number of count of how many posts have been posted there. You will see some surveys, which you just have to answer simply, briefly. These are ungraded. And then you will see the 5 module, 1, 2, 3, or 5. And then in module 1, there is just 2 videos to get you started with orientation. And module 2 is where we start with a teaching clip. And module 3 is clinical cases, and module 4 is handwriting analysis and movement disorders, and module 5 is question and answer sessions. Now, when you go through any of these modules, like you say you're doing these teaching clip sessions, you will see that one of the requirements for these teaching clips is that you have to complete an exit ticket. What is an exit ticket? An exit ticket is basically a simple summary of what you have learned out of that lesson, out of watching that video session or a round of clinical case. The exit ticket has a simple structure to follow, that structure that we call 3, 2, 1. So you have to write 3 things that you learned from watching that video, any 3 things that you learned, 2 things that you are still not clear on, or were not clear on initially, and then gradually became more clear, and 1 thing that you'll be reading on. Now, you could finish the whole video and then sit down and write the exit ticket 3, 2, 1, or you can write it while you are watching the video. It is an open book exam, but remember, it's proof of work. You just have to show the work that you learned something from this video and to get a credit for it. These are not graded exit tickets. They're just kind of a tracking of whether you have been doing something or not. Now, where can you submit it? Let me share my screen again. There are various places to submit it. The easiest place to submit it is this discussion again. You can create a new post. You can say exit ticket, and you can even write your name in front of it if you want, Danish, and you say 3 things I learned. And you can go down and say Okay, one, and so on and so forth. Okay, and you can create it, and done. Your exit ticket is created. The other way is to use the discussions in Discord forum. So if you go welcome to the course, you will watch my video, and right below my video, you will see a link to the Discord server, and a place, a kind of a discussion place where you can join and participate in discussion. The teaching clips are standard videos. Many of them are from teaching books or courses or my own teaching courses, while clinical cases are random cases submitted by my participants, and most of them I watched for the first time when I'm discussing them. So you'll see my exact approach on how I review a new case when I'm looking at either in the clinic or on a video. And then, as I mentioned, there are some handwriting analysis and question and answer sessions. Another thing that I've done is to give you some practice cases. So at the end of the clinical case module, you will see these practice clinical cases. And there are these 5 clinical cases which you are going to use my methodology in the previous clinical cases that you've learned so far. And then you'll write your analysis of these clinical cases. Again, these submissions are required, but are not graded. So all I need is a proof of work, and these practice case is a helpful tool to summarize and assimilate and practice what I've been teaching in my videos through these clinical case assessments, and for you to then practice it and write your own summaries. Again, they're not pass or fail, they're not graded, but these submissions are required for me to see that you have been progressing and watching some of these videos and learning from it. Similarly, if you go to the handwriting analysis module and you go towards the end of the module, there is one single handwriting assessment case that you can watch, and after watching it, you can write your summary of the case below. Okay, and then those are only a few of the assessments that you will be going through these courses. Most of these courses, just again, you're learning. All the assignments are for formative learning only, for assimilation of the information, and hopefully you will enjoy this. I don't want you to feel burdened. The goal of this course is not to create another burden on you. And remember, this course joining was voluntary. It's not something that was mandated to you. So I hope you came in excited that you're going to learn something very useful that will change remarkably your patient care on these movement disorders patients or movement disorder cases. And I want you to continue to have that excitement and build it even more. Every time you go through this clinical round or clinical case, every video that you watch, I want you to feel really excited afterwards and feel that it was fun, it was useful, and all these assignments should not be a water on the fire. I don't want you to feel burdened. Remember, these assignments are just for your learning and integration and assimilation of the knowledge that you're getting, and not pass or fail, not graded, not high stakes of exam, and just have fun with it. So welcome to the course, and I hope you enjoy it. Thank you.